I'm going to speak about our experience in the treatment of uterine fibroids with ultrasound guide HIFU. And well, the first thing is, uterine fibroids are very prevalent and cause significant morbidity in women. And of course, there is enough evidence about their negative impact on fertility. Okay, all you know this condition. Although the surgery has a significant complication rate, sometimes major complications, myomectomy is still considered the gold standard for women who want to preserve the uterus. And that is surprising considering that we currently have other minimal invasive treatments for our patients, occlusive procedures and non-surgical ablative procedures such as radiofrequency ablation, and of course, ultrasound guide HIFU. In my opinion, we should have knowledge of all of them and discuss with the patient which is the best option for her. Now, okay, well, from the presentation that precedes me, everyone already know what is HIFU, what HIFU is, where it originates, and how it works. So I won't spend so much time on these aspects, okay? Just to say that the ultrasound guide HIFU technique, in addition to being approved by the UK NICE, in 2019, the SG Working Group on Non-Surgical Ablative Therapy of Benign Uterine Disease was also created, of which our HIFU unit in Spain play an active role. And currently, according to the Focus Ultrasound Foundation, more than 128,000 women with uterine fibroids have been treated throughout the world. And this number is growing year by year. Okay, the therapeutic principles of this technique are really simple, but at the same time, amazing. The effect is very similar to that produced by a magnifying glass when it concentrates the sun rays, okay? But these concepts perfectly, okay? And its safety and efficacy is supported by several studies of pathological anatomy that demonstrate a coagulative necrosis with clear and sharp boundary between dead and live cells, okay? And this is the procedure, okay? On the right of the video clip is played in fast motion. You can see we make an ultrasound pre-scan from the sagittal view during different sections with 5 mm separation, but these concepts, I think, as previously mentioned, how it works, okay? Well, we can control the treatment by contrast-enhanced ultrasound during treatment or contrast-enhanced MRI after treatment, okay? In both cases, you can see here a number fuse volume of 100%, which is our objective, okay? Well, as you already know, after HIFU treatment, the fibroid will progressively shrink and the patient will present different degrees of clinical improvement. So that the follow-up in our center consists of performing an ultrasound 3, 6, 12 months and annually to calculate the volume reduction of fibroids and at the same time examine the symptom severity score with a specific questionnaire. Well, and this is our 14-year experience. Today we have treated a total of 862 patients. 18% of patients were treated in 2 sessions, okay? As you can see in this picture, only in 52 patients, the treatment was not achieved here, okay? 6% due to different problems such as pain, intestinal gas, air in the bladder, or for example, poor visualization due to obesity and other factors. Among the treatments completed, 94%, 68% were successful and 32% require a surgical procedure, hysterectomy or myomectomy. Okay, the mean age of the patients treated was 41 years. In 68% of the patients, the main symptom was hypomenorrhea. The mean fibroid volume was significantly higher than that of most series, 163 cubic centimeters, with an average maximum diameter of 7 centimeters. And very important, 43% of these patients, of these fibroids, had a high vascularization. The mean non-perfused volume, therefore, was 60% and with a failure rate of 52%. But not all cases are the same. The efficacy of the treatment depends on different factors, as a depth of fibroid, type of fibroid, obesity, fibroid location, different factors that can condition the treatment. Okay, of all the factors, the most relevant is the type of fibroid. Funaki's classification, fibroid type 1 or type 2 or type 3, depending on T2 MRI signal intensity, comparing with the skeletal muscle and the myometrium. Type 1 and type 2 fibroids are hypointense or as iso-intense and have a good response to HIFU. On the contrary, type 3 fibroids are hyperintense and response is much worse. The other factor to consider is the grade of vascularization. You can see different response between high vascularization fibroids at the top here, okay? Look at the small non-perfused volume in the center of fibroid, and low and medium vascularization fibroids below with a large non-perfused volume after HIFU treatment in both fibroids, okay? This differentiation is a constant in all publications and also in our experience. Well, the overall results of our series show a decrease in the volume of the fibroids. After 12 months, the mean volume shrinkage of the fibroids was 50%, okay, reaching 67% at 5 years. In parallel, the symptom severity and the quality of life scores were reduced more than 20 points, which has been identified as discriminator of clinical healing. The complication rate was only 7.5%, mainly first, second degree skin burns that did not leave sequels, 22 cases. Only 2 patients had a major complication, which was a 3rd grade skin burn. And there were other minor complications with no consequences. It should be noted that there were no cases of bladder or bowel perforation, and no patients developed amenorrhea after HIFU treatment. Therefore, 7% of minor complications in our series and 0.4% of major complications, which are lower than those of standard surgical procedures and other minimal invasive techniques such as uterine artery embolization. Okay, you can see here 52% and 3%. Okay, and another advantage of HIFU over these other procedures is that HIFU is always an outpatient treatment in our center. All the patients were outpatient with outpatient treatment. Okay, in relation to fertility, as previously mentioned, HIFU safely and effectively achieves ablation of uterine fibroids without damaging the surrounding myometrium. HIFU also preserves ovarian and endometrial function. We have some studies that show no significant difference between the anti-Muller and hormone levels before and after treatment. In this other prospective study from 2020 on the right, Melkozerova et al. Observed no significant changes in molecular and tissue markers of endometrial receptivity in women undergoing HIFU ablation for uterine fibroids. So the objectives of HIFU ablation of uterine fibroids in women with gestational desire, on the one hand, is to achieve the inactivation of the hormonal and vascular function of fibroids, okay? On the other hand, of course, to shrink them in order to normalize the uterine anatomy. Logically, this second objective is especially important in submucosal fibroids, but both things seek to increase the chances of obtaining a safe pregnancy without the complications of surgery. Okay, we already have several publications with good pregnancy outcomes after HIFU treatment. large series with high gestation rates obtaining full-term pregnancies with a normal delivery and without complications, no cases of uterine rupture or abnormal placentation. Our experience is not so much different from all these publications. In our retrospective study, we include 560 women with symptomatic uterine fibroids who underwent ultrasound guide HIFU between 2008 and 2018. Between 71 pregnancies of 55 patients have been obtained, which is, to our knowledge, the longest series of pregnancies after HIFU treatment in a Western country. The pregnancy rate was 34%, which is not bad if we compare with other treatments. Among the 71 pregnancies, there were 43 successful deliveries, including a natural twin gestation, with an incidence of cesarean section of 43%, which was much lower than in patients undergoing myomectomy or uterine artery embolization, okay? Or in those reported by other authors after ultrasound guide HIFU, which was between 50% and 81%. Okay, the rate of preterm delivery was 9%, only 4 cases, which is lower than in series of pregnancies with untreated fibroids or pregnancies following uterine arterial embolization. The mean birth weight of the 44 newborns was 3 kilograms, okay? 7 of them were low birth weight infants, these that you can see here, except for the 1.4 kilogram baby who was born with a previously diagnosed tetralogy of Fallot and intrauterine growth restriction. The remaining newborns, 98%, developed well without complications during postpartum and breastfeeding. Okay, these are the few complications detected during pregnancy: 1 preterm labor, 2 cases of placenta previa, and 2 cases of preterm premature rupture of membranes, okay? And during delivery, 2 cases of emergency cesarean section for fetal bradycardia and for hemorrhage associated with placenta previa, and 3 cases of retained placenta with manual removal and 1 case of severe preeclampsia, okay? It should be noted that our series had no cases of uterine rupture or placenta accreta, which can occur after myomectomy or uterine artery embolization. And these results were achieved in women with a medium maximum diameter of treated fibroids of 6.4 centimeters and a non-perfused volume ratio of 76%, which is higher than that reported in most series of HIFU treatment. Okay, finally, these are some of the cases we have treated as submucosal different of fibroids, okay? We can treat fibroids from all locations, okay? This is a patient with a submucosal fibroid, FIGO type 0, completely ablated and disappeared 6 months later with good pregnancy results, you can see, 2 months after this magnetic resonance image, okay? These other cases as a patient with a subserosal pedunculated fibroid, FIGO type 7, completely ablated. You can see here, the non-perfused volume is 100%. This is another case, a transmural fibroid successfully treated with HIFU and with hysteroscopic resection of the remaining myoma fragment 6 months later and this woman became pregnant spontaneously 3 months after this hysteroscopic diagnostic hysteroscopic, okay? Okay, cases of polymyomatosis with fibroids of different locations in the same patient, okay? The submucosal fibroid that you see here, okay? This is a submucosal fibroid, to completely disappear 8 months after HIFU. Just at that moment, the patient underwent a successful in vitro fertilization and got a full-term pregnancy that ended in a cesarean section. Sorry, excuse me. One second, please. Now, okay, another case of polymyomatosis. You can see here, this is 2 fibroids treated, okay? Of course, bulky fibroids treated with HIFU. And okay, as a conclusions, ultrasound guide HIFU is a completely non-invasive and outpatient procedure. It's effective and safe to treat fibroids, which a much lower complications rate than myomectomy. Ultrasound guide HIFU makes it possible to obtain full-term pregnancies with few intrapartum or postpartum complications in patients with uterine fibroids. Moreover, due to its non-invasive nature, HIFU seems to be the first therapeutic option in women with uterine fibroids and gestational desire, with many advantages over myomectomy and uterine artery embolization. And of course, even though we have more and more studies in this line, we need more prospective and randomized studies to confirm these observations. And okay, this gentleman here, this gentleman was called Archimedes, and he was a physicist, engineer, inventor, astronomer, and mathematician from ancient Greece, 3rd century before Christ. He created a system of concave mirrors that reflected sunlight by concentrating it on enemy ships during the Battle of Syracuse against the Romans in order to set them on fire. Okay, therefore, and as you can see represented in this painting, the concentration of and focus of energy in order to destroy is many years old. Its medical application has come to us with ultrasound guide HIFU. Let's not let time pass. Let's take advantage of it. Thank you very much. 谢谢。